Hello, my name is Michael Rösel and I'm your medical doctor here in Santanyì. I would like to welcome you here and I'm glad that you have taken the time to look at this video. In this video I will explain why you or your children on previous vacations may have suffered sudden and unexpected painful ear complaints. This happens quite frequently, especially in summer, to those enjoying the sun and the beach, swimming in the open sea or in the pool. Suddenly and unexpectedly, after about 2 or 3 days, you notice a slightly unusual feeling in your ear, which rapidly becomes a very unpleasant earache. The first signs you may notice in the affected ear are dull sounds or a feeling of pressure. Sometimes you only hear a crackling in your ear. Now you begin to wonder how something like this could happen and why. Where did it come from? In the onset of the symptoms, the earwax usually plays an important role. Let us take a closer look at the external ear. From the ear conch, we reach the auditory canal and get directly to the eardrum. To protect the ear, wax is formed along the entire auditory canal, building a thin protective layer. Outside conditions like wet, dusty, windy or hot weather may affect the auditory canal, as well as the formation and composition of the earwax itself. This wax acts like a water-repellent safety coating. It protects, among other things, the entire external ear and the particularly sensitive eardrum. It is also a mechanical barrier and serves as a shield against the smallest microorganisms as well as mites or insects. It protects the ear from drying out and also against excessive moisture. A healthy ear cleans itself. The old wax slowly dries and then falls out of the ear. Therefore, manual cleaning of the ears is not necessary. The use of cotton buds is not recommended in general. Under certain conditions, it can even be dangerous. After all, nature has not prepared our ears for uncontrolled mechanical interventions from outside. The task of the ear is to capture the incoming sound waves from the ear conch, sending them through the ear canal that leads to the eardrum. This makes the eardrum vibrate. The wafer-thin eardrum is connected to a small area with a tiny bone group that sends the vibrations of the eardrum to the inner ear. These bones are called the hammer, anvil and stirrup. Another special feature is that all ear canals have a more or less pronounced curvature, so one should not simply penetrate with a straight and slightly flexible instrument. With a cotton bud, the earwax is pushed deeper into the ear. Now the wax is seated in front of the eardrum. In the worst case, it even sits on the eardrum itself, and normally can only be safely removed by a doctor. Eardrum injuries caused by cotton buds are actually quite common. Through the use of these cotton buds, the important protective film of the wax is destroyed. In addition, the skin of the external auditory canal is irritated. This lack of protection makes perfect conditions for the entry of bacteria and fungi to invade and infect the skin of the canal. Using a cotton bud, you may also run the risk of accidentally hitting the eardrum, or even worse, piercing it. Here you can see very well what happens when you use a cotton bud to clean your ears. It is clearly visible how you create a wax ball and move it even further into the ear. Your actual intention is to clean the ear, but in reality this doesn't happen. It just makes it worse. In children, the ear canal is much shorter and narrower than that of an adult. Therefore, you reach the eardrum a lot sooner, causing considerable damage. But even if the eardrum is not punctured, this is very stressful and dangerous for the inner ear. On the other side of the eardrum, the small ear bones are located. These three ossicles are the smallest bone formation in the human body and responsible for the transmission of sound to the inner ear. The hammer is connected to the tympanic membrane. The mechanical stability is therefore designed at this point to exclusively transmit the sound waves that come in from the air. Pressing a cotton swab against the tympanum, you could seriously affect the stability of the whole system. In this case, I say, it's like David against Goliath. You can seriously damage your inner ear. My important advice to you is, do not put anything into your ear. Why do adults and even more children suffer earaches, especially in the summertime? Particularly striking in our practice is that we often find patients with ear pain a few days after the holiday begins. Usually these are patients who swim or dive a lot in the sea or swimming pool. Is there a connection between water and earaches? From my point of view, the answer is an obvious yes. Above all, dissolved salts in the water represent the main cause. Both in the sea and in the swimming pool, we come across various dissolved salts. The majority found in the sea as well as in the pool water consists of chlorine, the so-called chlorine ion. Even our table salt is half chlorine and half sodium. We can observe chemical reactions between the earwax and the dissolved salts in the water. They weaken the tough and water-repellent wax to the extent that it eventually changes into a smeary consistency. After bathing, the water normally flows completely out of the outer ear canal, so that it can dry quickly. If you have used a cotton bud to clean your ear, you may have moved the wax towards your eardrum. Now, the water can be trapped in the space between the wax and the eardrum. Then the so-called maceration begins. The eardrum and the ear canal become soaked with water, and the skin loses its protective function. At this stage, the ear sometimes feels damp or even moist inside, or you have the feeling that you still have water in the ear. In my practice here in Santanyì, I see another frequently occurring disease. Due to moisture, chlorine and other dissolved salts in the water, the wax begins to decompose, thereby losing its protective function. My personal advice before we go any further: you can avoid this problem in most cases if you rinse your ears carefully with fresh water directly after bathing in the sea or in the pool. If this is not possible, you can do it while showering in the evening. This, of course, applies to all of the family members, especially the children. Having lost the water-repelling qualities, the earwax will gradually be washed out, leaving the skin of the ear canal more and more exposed to the elements. The soaked skin of the ear canal no longer maintains its protective qualities and gives way to all kinds of microorganisms. This inevitably leads to a painful infection. We physicians speak of a so-called otitis externa. The first signs of this disease will hardly be noticed because the infection process begins slowly. Simply the feeling that there's something wrong with your ear could be an indication. If you notice an itching, a burning sensation or even pain, it means that the infection is already in an advanced stage. The most common mistakes in trying to cure the two previously described diseases on your own are made with home remedies or the use of cotton buds. No matter what home remedies you try, you will not fix the cause of the discomfort. With cotton buds, you even run the risk of worsening the situation. If you or your family notice the first signs of an ear irritation, it's best to see a doctor straight away. The doctor will usually relieve the situation quickly, so you can enjoy the rest of your holiday undisturbed. Finally, I would like to point out that a protracted ear canal inflammation can easily spread to the soft tissues of the head and the middle ear. This may cause complications during the treatment and sometimes can be tedious. If you had problems with your ears in the past, my advice would be, before you start into your holidays, have your doctor check your ears, just to make sure that they are in a good health. I hope I have given you some useful information with this video, so that you and your family can enjoy your upcoming holidays. I wish you all the best and good health. Yours, Michael Rösel from Santanyì.